The following lecture is brought to you by the Boot Camp Subcommittee of the Committee on Resident Education of the Society of Neurological Surgeons. The definitions of professionalism include highly educated, impressive competency, autonomy, comfortable salary, creative and intellectually challenging work, trust, and strict and moral standards. Professionalism also includes ethical behavior, confidentiality, a duty not to abandon because of inability to pay, putting the client's interests ahead of one's own, moral compass, work ethic and motivation, willingness to share in the transmission of professional knowledge and values, and a positive attitude towards the profession. The Acgme Outcome Project includes 6 core competencies. They are patient care, medical knowledge, professionalism, interpersonal and communication skills, systems-based practice, and practice-based learning and improvement. In this lecture, we will focus on professionalism and interpersonal and communication skills. The Acgme's definition of professionalism is, quote, manifested through a commitment to carrying out professional responsibilities, adherence to ethical principles, and sensitivity to a diverse patient population. When is professionalism measured? Through assessments such as peer evaluations, on-the-fly evaluations, by rotation, and annually. How is professionalism measured? Through duty hour adherence and documentation, nursing interactions, patient interactions, demeanor and dress, devotion to patient care, ethical decision-making, and contributions to the profession. The essence of professionalism includes continuous self-improvement and a lifelong learning and thirst for knowledge. You must read constantly, read systematically, master the field, and read throughout your career. Remember, you must also share your own ideas with professional colleagues by teaching, speaking, and writing. As a professional, you must learn how to deal with bad outcomes. Bad patient outcomes are sometimes unavoidable. Even for the best, perfection is unattainable. So what is expected of you as a neurosurgery resident? Your very best effort. An honest acceptance of results, including morbidity and mortality tracking, analysis, and reporting. A constant striving for improvement and practice-based learning. To care about those we care for. This is important as patients know if you are on their side and if you care about what happens to them. When you care, patients will forgive you, and you will forgive yourself. Honesty is critical, even after an error. When in a tough situation, be sure to involve your superiors for their experience in sensitive patient communications. Supervision is one of the main principles of surgical GME and is based upon a graduated increase in authority and autonomy over time. Moreover, the Acgme has recognized that surgical training is fundamentally different from non-surgical training. So in other words, one size does not fit all. How is surgical training different? First, there must be close supervision at every training level, mostly from the attending staff and senior and chief residents. Second, there are defined psychomotor goals for each training level. And finally, surgical training is like the military. It's a hierarchy. When does supervision apply? It applies in the operating room, for the key portion of the procedure, and for any portion in which you are not independently competent. It applies for ward and ICU procedures until you are specifically cleared for independence. It also applies for decision-making anytime you don't know or anytime you aren't sure whether you know or not. The key is to avoid surprises, things your superiors would want to know. When a patient is admitted, any significant change in neurologic status, transfer to a different care level, for example, the ICU, if an operation is needed, anything that will change the OR schedule, and an angry family. Just think about anything you would want to know in their shoes. The student can be summarized by the Chinese proverb, I hear and I forget. I see and I remember. I do and I understand. The teacher can be summarized by what Carruthers wrote, a teacher is one who makes himself progressively unnecessary. How are supervision and hierarchy related? The acquisition of competence, which is both cognitive and procedural. Graduated autonomy, as experience is the best teacher. And ethical behavior, leading to an uncompromising excellence in patient care. Fatigue becomes important during training, as it compromises patient safety, quality outcomes, and resident health. To address the issue of fatigue, 2 imperatives have been initiated. Regulatory compliance for PGY1s, including 16 hours shift limit, 80 hours per week averaged over 4 weeks, 1 in 7 days off averaged over 4 weeks, 8-hour minimum inter-shift break, and direct or on-site supervision. The second imperative involves quality and safety, which includes self-monitoring and the ability to ask for help when exhausted. Patient handoffs are a teamwork approach that shortens shifts. It is important to remember, however, that the transfer of knowledge and responsibility is a chance for dangerous errors and poor outcomes. What to do in order to reduce these risks? Keep meticulous lists of key information and issues. Leave time for ordered, careful handovers at the end of each shift without distractions. Leverage the electronic medical record. A few pearls. It's a long road. It's hard work. If you don't enjoy the process, it may be difficult to finish. Moreover, hard work without talent is a shame, but talent without hard work is a tragedy. Similarly, goodness without knowledge is weak. Knowledge without goodness is dangerous. What do we mean? You are all smart and talented, but what we are asking for is diligence and humanity. You should be excited. You are about to enter the most exciting profession in the world. How did you become a neurosurgeon? Everyone has a story. Just ask your peers. Neurosurgery is a community. Relationships define us. Chief and program, mentors, colleagues, patients, community, and family. Ask yourself these questions. How many people enjoy what they do every day? How many feel they are making a positive contribution to the lives of other human beings every day? Then ask a neurosurgeon these questions. The answers will be stereotypical. Almost no neurosurgeon regrets their decision. It's a long program, at least 6 years, with at least 36 months of clinical neurosurgery, 12 months as a chief resident, 3 months of neurology, time in neuroscience, neuropathology, neuroradiology, INR, and research. All in all, it can be calculated at 80 hours per week for 48 weeks a year, times 3 years. That's over 11,000 hours doing clinical neurosurgery. By comparison, training a concert pianist takes approximately 10,000 hours. Be sure to rest. When you are rested, you look better, learn better, and stay healthier. Take care of yourself. Spend time away from the hospital. Be with your family, and keep physically active. Don't be afraid to ask. Silence is often mistaken for misunderstanding. Ask attendings or senior residents when you don't know. It's okay to say I don't know, particularly to patients, to avoid providing wrong information. Most of all, remember that sometimes you don't know when you don't know. The ability to prioritize is key. Who are the sickest patients? Emphasize their handoff. Re-examine them. Prioritize their care. Stay organized. Keep lists. Be practical. And in the end, brain surgery is really just common sense. Make sure you prepare for cases. Operating in a protected learning environment is a precious and extraordinary privilege. Enter the OR rested. Read about the case. Study and understand the goals of the operation. Meet the patient if you can. Accurate and timely communication up and down the chain of command is critical. There are 3 answers to any question: yes, no, or I don't know. Think before you speak, don't speculate. Nothing substitutes for seeing the patient yourself, repeatedly if indicated. Experience is critical and precious. Always listen. You are not expected to know everything, but you are expected to learn. Always keep your composure. Avoid becoming argumentative with your supervisors, peers, or others at any level. Your education and ultimately your success depends upon their willingness to share knowledge. Positive professional relationships will allow you to excel and will help your patients. Don't come with problems, come with solutions. Neurosurgery is defined by the need and the ability to get it done. In the end, the buck stops with you. Just take it one day at a time. As Atul Gawande said, better is possible. It does not take genius, it takes diligence. It takes moral clarity. It takes ingenuity. And above all, it takes a willingness to try.